Good morning, everyone. Welcome. Andrea, can I get sharing capabilities? I have sharing capabilities. I just noticed it. So I'm going to share my screen, and it's today's community forum slides. So my name is Jeanette Angulo, and I'm the Imperial County Public Health Director. This is actually our third community forum. We kicked off with an initial one. We just wanted to learn more about, what was happening in our community, about the needs, the gaps. And then out of that, we decided to, do additional community forums and just keep them going. The first one was about a week and a half ago. It was on a Friday. We said every other Friday. However, because of the holiday, coming up this Friday, we moved it up to today. So just this time it'll be Wednesday, and then we'll go back to the regular Fridays. So today, we're going to do a quick icebreaker, and then from there, I'm going to move on to COVID-19, our updates, and then to our guest speaker. Let's go right into the COVID-19 cases and deaths. So in the United States, as you've seen, maybe, lately over 12 million cases, and that number is for deaths, over 260,000 deaths just in the United States. And that information is from Johns Hopkins University. Now, in California, we've seen over 1.1 million cases, positive COVID cases, and over 18,700 deaths. That information is directly from the state's COVID-19 website. And then in Imperial County, over 15,700 cases. And just this morning, we reported an additional death. So we are at 356 deaths. If you haven't visited our dashboard, that is the dashboard and where we have the numbers, the COVID case numbers and deaths, as well as additional information, cases by zip. We have trend lines, cases by age group, etc. Up at the top, I've included the websites. You can either go directly to the icphd.org website, or the direct link is right below. The slides will be made available on our website. So those will be interactive links just in case you want to peruse later. This is something new that got added, and it was actually a recommendation that was made by an ad hoc group. It's a committee that meets, and it's a newer committee, and it's made up of a couple different members from this community. They said we truly want to see more of like a trend line, and so I believe this graphic is about a month old, and it shows our activity since March. And as we know, we surged back in May, June, July. And earlier in October, we were seeing an increase. It was a slow increase, but if you take a look at what has happened in the last weeks, it's the increase has spiked quite a bit in Imperial County. So this information, this is one of the tabs that's actually available in that dashboard. So you can go in, and if you hover over any one of those dates, it'll give you the test, the cases, the number of cases by result date. State metrics. So this is from the COVID-19 website. If you've been following, the tiered system, Imperial County is still in the purple tier. And last week, over 40 counties were rolled into the purple tier because of all the activity that's happening in California. Yesterday, a few additional counties were added to the purple tier. So going into the actual cases per 100,000, you notice there's two numbers here. There's the 61.6 new COVID cases per day per 100,000 and 39.4 adjusted case rate for tier assignment. So last week, the state decided to utilize, instead of a 7-day lag, which they were using, they're now using a 4-day lag. They hope to return it to a 7-day lag in the near future, but for now, it's, you know, a 7-day average with a 4-day lag for the state numbers. So going back to the adjusted case rate, that adjustment is done because we are testing a lot more than the state average. So we have a higher testing. We're doing a lot more testing. But the number to keep an eye on is the 61.6, because that's the actual case rate per day per 100,000 population. And for a county our size, that's quite a bit of activity. The positivity rate is at 15.6%, and that's with the state metrics. And I believe some of you have heard me say that our local data is not defined exactly the same way as the state data. So you'll see some differences in the next slides in case rate and positivity rate. And so it's because of that. Also, because we still receive case lab reports via fax, via email, and those are not always accounted for in a timely manner in the state's system. They are accounted for in our local numbers. This is from our local dashboard metrics, and this is what I was mentioning. Our metrics will not always be aligned or the same as the state metrics, and this is, you know, pretty much the same across California. You know, local county dashboards are not always, the numbers don't always match. The other difference is the state numbers are updated once a week. Our numbers get updated Monday through Friday. Something to notice here is the activity since September 15th. You'll notice that, you know, our case rate has significantly increased since then. This morning, we reported a 63 case rate and a 30% positivity rate. So what else is going on when it comes to COVID-19? There's ongoing coordination with local, state, and federal partners. A lot happens behind the scenes. We're working with our hospitals, we're working with our skilled nursing facilities, with our other congregate living facilities or jails, and, you know, with the public health department, we have our program that helps secure resources. So if there's any request, any need from any of the facilities we work with, you know, they submit requests to us and we push it up, you know, to our state and federal partners. So that's going to be ongoing. And it's not just supplies, it's also, you know, staffing support that we request. And we're working with our local hospitals because they are in need of staff. So again, that staffing request is submitted, and, you know, teams of staff then in turn make it to the hospitals, but not only the hospitals, it's also for skilled nursing facilities and the public health department. So really quick on staffing for the health department, contact tracers, because our activity had scaled down, it was not, you know, it was somewhat sustained back, you know, in early September. Our contact tracing and investigation need was not as high. At one point, we had over 100 tracers and investigators, so we scaled it down to about 35. Because of our increase in cases, we submitted an additional request to both the state and our federal partners. And so in the next few days, we will be getting an additional 15 staff. And then internally, we had cross-trained nurses and other professionals to help with this contact tracing and investigation task. So we are again reassigning them to our epidemiology section so that they can help with, you know, these duties. As far as the alternate care site, as it was announced, it started receiving patients. This site is over at the Imperial Valley College, and it's being staffed by state personnel. They're working closely with the hospitals, local hospitals, and we've had patients transported to the site, and they are being seen there. So the number fluctuates. Yesterday it was at 10. This morning, I believe, and I wrote it down, we were at 11. One was going to get discharged. Additional patients were going to be admitted. So it's always, it's not a fixed number. It's always going to change. So again, we are seeing patients at this alternate care site. As far as testing resources, great news. And that's what I mentioned during the last forum, that we were working with the state to secure additional resources. So the fixed site that is currently up in Brawley, we're going to keep that site, and in the near future, if it needs to be moved to any other site because there's a need, then we would do that. But for now, it's going to stay in Brawley. We also secured, we were approved for a mobile testing unit, a big bus or RV kind of unit. So we're working on bringing that down, and travel teams. And the beauty of that is that those travel teams will be able to go throughout, travel throughout the county, and wherever there's a need, we can schedule, that travel team to be there. So if there's an outbreak and there's a need for testing resources, we'll work, with our community to make sure that those resources make it there. So again, increased access for our community when it comes to testing. There's going to be plenty of testing coming in, and it's going to roll in the next couple of days. It's not going to be here tomorrow, but do expect it within the next week or so. A lot of planning and logistics that'll need to be worked out. As far as the vaccine update, so we are expecting very limited supply of vaccine in California in mid-December. We still don't know how much that, how many doses that will be. None of the counties have received that information. We started coordinating with our local hospitals and our medical society early on. This was back in September, and it was mostly email, keeping them updated as to what was happening when it came to COVID-19 vaccine. A lot of unknowns. Once we had a little bit more solid information, we reached out to partners and convened the first meeting, and that happened this last Friday. And, we talked about, vaccine planning, capacity, and a few other things. And they're actually meeting right now. They're having their second meeting at 11. They started at 11 today to continue talking about, what are we going to do in Imperial County once we get the vaccine. We have to have a plan, and that plan for Imperial County is due December 8th. So a lot going on behind the scenes. And then what I wanted to share with you is the prioritization and the phased approach, because quantity is going to be limited initially. The state, is looking at, vaccinating those who are, high risk health workers first, as well as first responders. So I just wanted to share this graphic so that, you sort of kind of had a glance at the faces, and, the face, we were going to start with, and again, who we were going to focus on. So as more is known, once we know how much we're getting, we'll definitely share that with our community. For this holiday season, and this is the last 2-3 slides that I have, our message to our community is, stay safe, stay healthy every day, and, especially during the holidays, because, we tend to want to, gather and celebrate. But this year we're asking, that we celebrate differently. And I'm going to go back to this slide. And in particular, the activity that we're currently, seeing, the surge that we're seeing. And again, if you notice, it's looking a little similar to what we had, back in May, and June. The only difference today is that we learned a lot. And when I say we, it's many of our agencies locally, our hospitals, have done a wonderful job in increasing capacity, to make sure that our community, can be served here locally. We've worked with our state partners, the alternate care site. The equipment was always at the Imperial Valley Gym because we understood that there could be a second surge in the fall. And so as soon as we started to see, the activity increase, we started talking to our state partners and said, we need to get ready in case the service is needed, and we've increased access, or we are in the process of increasing access to testing. And a lot has happened, and a lot, has been done by agencies to prepare for, exactly this. So our message to our community, keeping in mind what's currently going on, is, celebrate Thanksgiving safely. Think about those lower risk activities that you can do, and then just put everything on a balance. What are the moderate risk activities and what are the higher risk activities? And what are you willing to do? So sharing, how you can celebrate safer at home, staying at home and doing virtual, a virtual dinner and sharing recipes with families and friends. That would be the best. If you're shopping, maybe shopping online is the better alternative for you this year. Know, what those moderate risk activities are. And if you're going to gather in Imperial County, we have an order that no more than 16 people from, 3 households can meet, including the host, and gathering it outdoors instead of indoors keeps everybody a little bit safer. But don't forget, that even if you gather outdoors, practicing social distancing, wearing a mask, and practicing all those prevention messages is great. And then just know that if you are at large gatherings or crowded places, that your risk increases. So I'm going to stop there and just say that this info is available to the community. We've been sharing it, and that's it. Any questions for me? No questions for me? All right. So thank you, everyone. Andrea, we have Jolene next, right?
Yes. And so I can. You know what, Jeanette, I didn't catch any of that. I don't know if anyone else had an audio problem with you.
Maybe it was me. Luis, can you hear me?
Yes.
Okay.
I have a really brief question before moving forward. Thank you for the information. So it's about the testing, and I know that, so we are approaching a similar, like a similar level of cases. And the last time the expansion was 3 testing sites, that was 3 in Calexico, Imperial, and Brawley. And what I'm hearing is that the Brawley one is staying in Brawley, and then there's the other forms of more mobile. Are we going to have the same amount of testing capacity with these new kind of ways of doing testing that are not the sort of the Imperial and Calexico one?
It'll be a lot more. So let me answer that first piece. So for example, with the mobile testing, we have the capacity to do over 500 tests a day. And something else is that there's flexible hours. We're going to be working with flexible hours. If we want to do Monday through Sunday, we were talking about 1 a.m. just because, you know, our population, you know, farm worker, agricultural population, sometimes that's the start of their day. So a lot of flexibility, and a lot of that is being discussed, and logistics and working with partners. So yes, a lot more capacity.
Great. Thank you for that. And I can see how the flexibility is actually a plus.
Okay, thank you. Are we ready, Andrea?
I have one question, if I may ask.
Sure. Was
Thank
that
you.
Daniela? Sorry,
Yes,
yeah.
this is Daniela. Hi, everyone. Good morning. Thank you so much, Jeanette, for that information. I did have a question, and I did join a little bit late, so I do apologize if you talked about this already. But I know that you talked about the department working with some folks to develop this vaccine plan that's due in December. And I'm wondering if you could speak more about who's part of that planning. And then, I know that the Department of Public Health recently appointed various organizations to be a part of a community vaccine advisory committee that is actually like having a meeting right now. So I'm wondering if you can speak about whether some of the community groups that have been selected to be part of this membership list are also able to be part of this planning group that you have convened.
So the answer to the last question is yes. And just like you saw in that phased vaccine shot, we're talking about immunizations and shots, right? So the graphic I showed about the phases and COVID vaccine, prioritization, that's exactly what we're doing, because there's a lot of unknowns still. So we're going to be phasing in partners as, you know, more is known. So the first phase is really talking about and convening vaccinators and looking at those who can vaccinate the higher priority groups. So the ones that were part of the initial meeting were both local hospitals. It was our federally qualified health center, which was it's Clínicas de Salud del Pueblo. It's Indian Health Services. And so that was the initial group, given, you know, what we needed to discuss. There's going to be sections or phases where we need to discuss prioritization once we get more vaccine. Communication is part of this work that needs to be done, and definitely CBOs. We're going to need the support from CBOs to make sure that the information is getting out there and that we're actually targeting all the vulnerable populations. So like with everything that we've been working so far, it's going to be a phased approach, because we here at the local level even have questions, and we understand that not a lot is known. A lot is, information that's anticipated, such as, we anticipate some vaccine to be available, but we don't know for sure. So again, yes, there's going to be opportunity, and we're working with different kinds of providers. So next week, we're going to be working with the Medical Society, local healthcare providers, and then we hope, to engage non-clinical providers. So again, phased approach.
That sounds good. And, as a kind of community advocate and organizer here, I'll kind of share this in front of everyone as well. But there is a recommendation to convene all stakeholders, similar to the model that the state is taking in terms of the Community Vaccine Advisory Committee. If you see who makes up that group, there's folks that are also like administering the vaccines, but also folks that are part of the outreach and all the other components. So I think that, a recommendation would be to you know, engage these folks so that there's communication across all early and not necessarily having siloed conversations. But I think that, you know, this is a model to follow as well. So just wanted to share with the other folks that this is happening at the state level. And I think that the members that are part of this advisory committee should certainly be a part of the early conversation as they get the information directly from the state as well. Thank you so much, Jeanette, and everyone else.
Thank you for your comments, Daniela. And just know, yeah, there's 15 different sections to this plan, and engagement of key stakeholders, clinical and non-clinical is part of that, and it will be embedded. Thank you, Daniela, for your comments.